This is All India Radio. In the program Spotlight, now we bring you a discussion on Prime Minister's message to the citizens on following COVID Appropriate Behaviour. The participants are Shekhar Iyer, political analyst, and Chetan Chauhan, journalist.
Today we are discussing the Prime Minister's meeting with the Chief Ministers of Northeast, where he discussed the rising cases of COVID in Northeast and how the situation for the first time in Northeast is alarming. The central government has also sent teams to at least 4 states in Northeast to review the COVID situation there. Shekhar, Prime Minister yesterday made a very emphatic point that large number of people are going to hill stations, which can lead to another spurt of COVID.
Chetan, as you mentioned, he was addressing the chief ministers of the Northeast, where there has been a spurt in the positivity percentage. So therefore, the Prime Minister chose to have a meeting with the chief ministers of the regions. But the broad message he gave, I think it applied to the entire country, to other states as well. Because we have seen that crowds back at many places, particularly in hill stations. Recently, some of the pictures that were put on the social media showed actually the situation has become very alarming and there is a laxity which is again coming. It's a very dangerous trend. So the Prime Minister utilized his opportunity of addressing the chief ministers of Northeast to convey a broad message by saying that, look, everybody is talking about a third wave. And some people are even saying, before the third wave comes, now that it appears the second wave has abated, so why not let us, make the best use of this interim period because the third wave will come. But as the Prime Minister pointed out, the third wave is not something that is coming on its own. It is rather, it depends entirely on us. It is because the virus requires the human factor. So therefore, we need to ask ourselves, not when the third wave will come. Now, are we going to allow the third wave by our non-COVID protocol adherence behavior? I think that is a very important point he mentioned. And as a follow-up to yesterday's Prime Minister's remarks, today, the Union Home Secretary has returned to all the chief secretaries, particularly pointing out this R factor, what is called the reproduction factor. There is a mathematical model developed by the Madras Mathematical Institute, where they are showing that even a small point increase in these reproductive factor of the virus, calculated in mathematical model form, is a pointer towards a grave situation. So therefore, I think the Prime Minister has issued a warning to guard against this laxity. Just because positivity is declining in some places, we should not lower our guard.
Shekhar, the Prime Minister's emphasis was extremely clear that we cannot lower our guard. Even if vaccinated, we have to mask ourselves. Vaccination may not get the disease, but we can be the spreaders of disease. A large number of people are still unvaccinated. So we have to be extremely careful. On the Northeast front, Shekhar, the Prime Minister emphasized on this micro-containment zone policy, wherein he also praised Assam Chief Minister Himanto Biswa Sarma, saying that they have adopted a very proactive containment zone policy, because of which they had to do minimum lockdown. What do you have to say on this?
No, as the Prime Minister pointed out, there are advantages as well as disadvantages if you are going for a micro-containment zones instead of a complete lockdown. Because a complete lockdown does affect a lot of people even in areas which are not seen as sensitive zones. So the Prime Minister welcomed this idea as followed by the Assam Chief Minister, where Assam has followed something like 6,000 micro-containment zones. But the Prime Minister felt, when you are having this kind of containment zone, one big advantage is that you can pinpoint responsibility, because whoever is in charge of these micro-containment zones, he or she has to ensure that the positivity cases remain under control, and particularly the reproduction factor, the R factor, is also under control. And it is also easier to fix responsibility, because if the results are good, then we can draw the lessons from the person who is in charge. The results are bad, we can find out what has gone wrong, how it can be tightened. And also, we have had the first wave. Then now the second wave took us by surprise and hit us very badly, completely challenging our infrastructure. So therefore, Prime Minister wants all the states, all the government officials to look at the experience we have gained over 1.5 years and what kind of practices, because even in states which were once praised, like say Kerala was doing some good job, and in fact fact, there was a lot of praises for how the state administration handled. But today we are finding that even there again the cases are going up. So therefore there is some kind of a constant change in how the virus is changing forms and also trying to affect more and more people, and that largely depends on the human behavior, because people feel that because of the lockdown there has been an economic impact and people are eager that somehow the normal activity can be ensured and the economics of it can be taken care of. But the danger remains is that you cannot lax, you cannot lower your guard, because that is a very important thing. And of course, the Prime Minister also dwelt on the other issues, particularly the last cabinet decision where 23,000 crore has been allocated for the second phase of creating health infrastructure, both under the central scheme as well as centrally sponsored schemes, where the state government will also bear. And the idea is to create something like 22,000 additional hospital beds, ICU beds, set up oxygen plants, and also take care of the pediatric care, because we have seen some children are also affected in this current pandemic. So the idea is utilize this money in the next couple of years to see that the health infrastructure aspect, which came into sharp focus when we saw the second wave take a very ugly turn.
Shekhar, the Prime Minister also emphasized on vaccination. He said that to stop the third wave, one of the important factors would be evaluation of the vaccination process across the country. The Prime Minister also said that the Government of India had made vaccination free for all, but the state governments have to focus on the areas where the spread is getting faster. But some states have been complaining that short supply of vaccines, because of which they have not been able to increase the vaccinations. So there is some sort of a tussle between center and the state governments over vaccination for the past few months.
Chetan, there are two aspects to this vaccination policy. See, initially there was a lot of confusion as to, how the states will procure and how it is difficult for them to, do it directly. And even though initially they had sought that kind of to procure themselves, but finding it difficult, finally the center stepped in. There was a Supreme Court directive also in this matter. And now the picture is clear. The central government is doing all the procurement and is sending to states. But I think there is another problem. You see, there are areas where there is vaccine shortage, but there are two other problems associated with this. One is the vaccine hesitancy. See, this continues to be a problem because where vaccines are available, the number of people turning up at the vaccination centers is in some places not up to the mark. And the second aspect, which is also important, is the vaccine wastage. The wastage is also a factor which the central government has been emphasizing on state government, that the percentage of vaccines being wasted. Now, that is why the Prime Minister in his address to the CM mentioned about the need to involve people from social, cultural, religious, education, and involve the celebrities also, because they can also dispel the myth about vaccination, because this is also real. Where vaccinations are available, there is a tendency to either take it, it is going away any case, why should we take vaccination? On the other hand, some communities have been traditionally opposed to, for whatever reasons, regarding vaccination. And like in the case of polio vaccination, involvement of community leaders and religious leaders helped in a great way in, covering mass immunization. So similar exercise is required, and some states have already done it. So this is a very important aspect, because we have to ensure that when under the scheme of vaccine for all, more number of people are covered, there is less wastage of vaccine. And at the same time, we have to also ensure, because the issue of shortages come when I think the states will also need to coordinate better with the center. But at the same time, this kind of exercise is one which requires nobody to lower the guard, and also, as Prime Minister pointed out, to concentrate in those districts where, already you are seeing the positivity rate going up. So the state governments will have to, work out their own programs, their own priorities, and concentrate in those districts where, again, the figures are showing, the seropositivity is high.
Shekhar, you spoke about the positivity rate increasing in some of the districts. Yesterday, the Health Ministry pointed out that in 70 districts of the country, which is about 10% of the districts, the positivity rate is increasing, and many of the districts are in the southern states of Tamil Nadu, Kerala, Karnataka, Andhra Pradesh, and Telangana. Also, if you see the maximum number of increase in cases, the southern states are contributing almost 50% to the everyday COVID cases. and the Prime Minister will be holding a similar meeting with Chief Ministers of Southern states on July 16th. Do you think, Shekhar, that the Southern states are of concern?
Definitely, Chetan, there are signals that call for taking a serious view of whatever figures we are getting. Particularly, Kerala, it is very surprising, despite being a very alert administration, and when we get to hear that, in fact, the proper tracing of patients, proper tracing of people arriving and departure. So when all these are going on, but still there is a rising number of cases. This shows somewhere along the people's behavior, and that is true of Tamil Nadu also, where, soon after the assembly elections got over, results came again, there was a tendency to think that the virus is gone, so let us get back to normal life. But they do not realize that this is a new normal where they will have to wear the mask, they'll have to follow all the COVID protocol, right from washing of hands to using sanitizers. So this constant need to be, reminded of the fact that some of the very basic things which we learned 1.5 years ago has to be followed with same rigor as of today. And unfortunately, in some southern cities and towns, there has been definitely, I would say, errant public behavior, and authorities too find it little difficult to enforce. So I think they also need to look at this in a very serious way. They'll have to accept this new normal of wearing masks, using sanitizers, and avoiding crowds.
Shekhar, the Prime Minister and the meeting in the Northeast and other meetings also which he is having with the state governments to review the COVID situation have been emphasizing that the states can learn from each other. There are the best practices which they can adopt from other states. Like he was giving an example of Assam and containment zones. But if you see the two COVID waves in the country, there have been several good practices which the state government has shown. In case of vaccination, also some states like Rajasthan had extremely high number of vaccinations, primarily because they reached the rural areas very fast, whereas some states have been poor on this. So this exchange of ideas for COVID management in the country, do you think it is happening, and how can the central government help in that?
Well, for instance, people have looked at the model which the Mumbai region initially Mumbai was a case of a lot of concern, but subsequently, things got better, and they followed a particular way of containment zones and increasing the case of testing and vaccination. So that model was seen as a very good model. And in some other states, what we have seen is, as the Prime Minister said, look, the number of testing has increased. Rather, from random testing to particularly testing travelers, people who are arriving from other states, that has gone up. But what the Prime Minister suggested is, why not have aggressive testing in clustered blocks? The blocks of in urban areas where you are getting the high positivity figures, why not go for more testing in those areas instead of attempting to cover the entire city or the entire metropolitan region? So I think there are certain ideas where we have seen, in fact, some of the states like Kerala was initially doing very aggressive testing as far as aggressive follow-up. Because every visitor who arrived in Kerala was asked to register, and then subsequently health officials would go to that locality, check whether that person has quarantined himself. Now all these things have to be again revisited and will have to be brought back. Because those states where these things were followed, again we are seeing the figures are going up. Now the other worrying aspect is, we are headed towards the festive season. Well, we'll have after a couple of months, we'll have the Dashara, then we'll have Diwali. Now we will have to remember this is the same period in last year when actually the ground was being prepared for the second wave. So similarly, this time I think we need to keep in mind festivals will come and go. Already we have seen yesterday Uttarakhand banned this Kavadiyas, and today Supreme Court has asked UP government to explain why it is still thinking of allowing Kavadiyas. And with Prime Minister's remarks yesterday that there should be no laxity, there should be no room for complacency, and we need to maintain that guard with renewed vigor, with renewed sincerity of purpose. I think every citizen will have to make the contribution that he was called upon to make earlier. So I think this is the time when things appear to be getting normal, that is also a time when things can suddenly go out of control.
Shekhar, the Prime Ministers have been emphasizing that state governments cannot lower the guard, other people cannot lower the guard, the contact tracing has to be improved, the micro management of COVID has to be done, whereas the business has to also continue because we cannot allow the economy, the country to suffer. So in this slide, the Prime Minister had been holding meetings with the Chief Ministers, like Northeast he did yesterday, Southern states he will be doing next week. In between, in the past 1 month, he also held meeting with the state Chief Ministers where the COVID cases were rising. So there has been a lot of focus from the Prime Minister on COVID management, and he has been telling people that the mask is the only way save yourself from COVID. Vaccination is the second most important thing. With this, Shekhar, I want to really thank you for being with us.
Thank you very much, Chetan.
You were listening to a discussion on Prime Minister's message to the citizens on following COVID appropriate behavior. The participants were Shekhar Iyer, political analyst, and Chetan Chauhan, journalist. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on a mobile app, News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may email your opinion about this program at airnsdtalks@gmail.com.